Well, hello everyone, and today I have a special guest with me today, and her name is Dr. Ruth Sterling. And this is awesome because I actually get to share what the doctors are actually feeling when they're having babies and how soon they recover and all the aches and pains that they go through, or whether it's emotional aspect and things like that. So, first of all, Dr. Ruth, or I will call you Ruth actually, it's easier that way. Congratulations on having your baby
Yeah.
boy 2 weeks ago. I believe he's sleeping beside you there, right?
Yeah. That's why if you see me turn my head, I'm just peeking and making sure he's right.
Yeah, it's great. Okay, but before we go into the questioning time, I just want to introduce you properly because you have done so much in the obstetrics and gynecology world. But basically, Dr. Ruth graduated from Sydney University as a medical doctor, and then she completed her medical studies specializing in obstetrics and gynecology. You have been a consultant obstetrician at our major Sydney hospitals like Royal North Shore Hospital, John Hunter Hospital, Newcastle, Westmead, and some of the major hospitals. You
Well,
have
I've worked those places. I haven't been a consultant at all of those places, but I've
okay,
definitely
well,
worked.
okay, great. Thanks for that. And you have also completed fellowship at Guy's and Thomas Hospital in London, and then you came back to Australia, and you're now a staff specialist in one of the Sydney hospitals or the tertiary units at one of our Sydney hospitals. So you do quite a lot. You're a bright, bright woman. So this is great to have you.
Well, it's all a part of training, isn't it? So
Yeah, yeah. So I totally value your time. There we go. We have a cry. This is awesome. Well, he's for real. It's great. Yeah. Okay. So you had a cesarean section and it's been 2 weeks. And can you just share with us, the aches and pains that go in that area and, just to comfort mums also to what they can do, what they can't do, all that sort of stuff.
my major aches and pains were in the just below my belly button and above the scar. And I have found that for me, it's been very more like nerve pain, so quite burning along the skin area. Earlier on was quite deep. You could definitely feel the muscles aching and fatiguing really quickly. And so obviously getting in and out of bed was a struggle. Turning over at nighttime is sometimes a struggle. But every day does get better and better and better. So 2 weeks on, obviously much better than the first few days, and does improve consistently. I was on significant pain medications for the first week and a half, or first week mainly, and then as needed strong pain medications when I got home. And I did take that for a few days, definitely morning and evening. But now I'm not taking anything regularly. But if I do feel like, say, I've done too much and I feel you'll know when you need some pain relief, I do take it. But I'm trying not to, have to take that as often. And obviously everybody's going to be a little bit different. So you have to just kind of listen to your body if you need the pain medication more. Some people need it more in the morning to get going and be able to manage throughout the day. Some people need it more at night, enough in the daytime, and they're a bit more achy at night. So in order to get some sleep, and not that you're getting much sleep with the newborn, but in order to rest a bit more,
Yeah.
you might have to take it at night. So it's a little bit different for every person. It's not going to be the same.
Yeah. Yeah. And we were talking about, doing some exercises and things like that. And, even you said to me, even just to do the pelvic floor muscle lift or contraction, that was painful as well.
Well, it's not that it's painful, but you definitely can't hold it as long as you used to, sustain it. And it's just a bit uncomfortable to actually do it. I mean, obviously there's that pelvic floor side of it, but also even using your abdominal muscles, and in a C-section, we are kind of stretching those muscles and, in order to get access to the uterus. And I think you just have to be smart in giving yourself time to heal and for that strength to come back.
Yeah.
So 2 weeks on, I've done 1 or 2 just testing out myself to see what it feels like.
Yeah.
And, it definitely feels like a lot more work to do that. So I've kind of gone, well, probably not there yet.
Yeah. 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 That's great. And but you're just keeping mobile and hydrating and looking
Yeah.
after yourself.
So you have to be mobile, or else you're a sucker for clots. So, I'm not just sitting at home in bed or on the couch or anything like that. I'm moving around. You don't really have a choice when you have a baby. You have to be getting up and down and,
Lifting. Yeah.
lifting them. And um, so, being active with what should I say, in moderation, let's put it that way,
Mhm.
going for a gentle walk outside, or just even in the house, is probably all I'm really doing,
Yeah.
from an exercise point of view. But yeah, definitely staying mobile, and it helps with, swelling of the legs. I had some swelling of the legs, and it just, that's all gone down now, 2 weeks on, but all of that. Yeah.
Yeah. Yeah. That's great. And I was going to say to you, yeah, what about women? No, sorry. I was going to ask you because, we're talking about your well-being and how well do you feel within yourself? Because I guess everybody's different, but some women suffer postnatal depression and all that sort of stuff. How are you
Yeah.
doing?
I'm actually doing okay. I was actually quite mindful of the baby blues and all of that kind of stuff. I had geared myself up to meet that head on, thinking, okay, I'll likely experience the baby blues, and I'll likely experience this, and I'll likely experience that. And surprisingly, I haven't. So, when they say, it's not a guarantee that you will, it's a possibility, but it's not a guarantee, because I definitely was looking out for it. Mentally, I'm fine. I don't know whether or not this whole COVID scenario world that we're living in at the moment, whether or not that's so big that my focus is on a lot of that, and therefore all the usual mummy things that you would experience on some level seems to be tempered with that. I'm not sure whether or not that has played a role in it.
Right.
But for me personally, I didn't experience the blues. I am very conscious of isolation, I guess, on some level, and the isolation that I would have experienced anyway, being a first-time mom, considering often you are alone at home and stuff like that. Thankfully, I had my mom here visiting for a bit, but even more so, there's a lot more isolation now because of this whole COVID stuff going on. So I guess I'm very conscious, of calling people, and people are calling me, and, still trying to stay connected, because we can't just assume that you are going to be connected anymore.
Mm, yeah.
But, a lot of women do experience the postpartum blues, and that can progress into depression. And so I think people just have to be very mindful that everybody's experience is going to be a little bit different. And if you're aware of it, then you can keep an eye out for it, and therefore get help, or counteract that as early as possible.
Yeah, sure. And you've been quite good in working with your doctor, even though you're the obstetrician yourself. You would be
Oh
giving
yeah.
advice to people,
I
but
had to be the patient. That was my first instruction when he saw me. He basically said, you need to be the patient, and let me be the doctor. And I said, okay, how do you want me to do that? And he gave me instructions, and I followed them.
yeah, that's great.
Yeah.
Yes. Yeah, awesome. Well done. I love that. And it just helps, I guess, in some ways, just to put your mind at ease, even though the table has turned now, and you're the patient. And
Well, I also had a good obstetrician, and he was very kind of easygoing, but he also was very kind of mindful of my position as well. So he'd be like, so what do you want to do? Or this is how would you like to do this? And I would say, and he'd say, this is what I would prefer. And I'd say, okay, I don't have a problem with that,
Yeah.
or yes, yeah or nay. Or he would say, I'd like you to do this. And he would give me the information and give me the reasons why he wants me to do it. And I'm like, fair enough. Okay, that's okay. No
Yeah.
problem,
Yeah.
So, it does help when you have a good doctor
Yeah.
that you feel comfortable to kind of just release. I don't have to have a stranglehold on my care per se. I was happy to let him make most of the calls because he was making calls that I would have made anyway. So,
Yeah.
it just we were all on the same page, and so that helped a lot.
Yeah, great. So I also would like to ask you a question about mums who have had a toddler around and now they have a cesarean. And I know one of your friends was in that position, a couple of years back, I think it was now, or a year ago, or something like that. And yeah, she had a cesarean. And how do how can mums make the most of it and look after themselves when they do have a toddler to look after? And
I think you just have to pace yourself, and you have to realize that you have to set your priorities, so there's some things that are just going to have to fall to the wayside, and that's reality. So, if your priority will be the baby and your toddler, and so the housework and some of the other things that you will see and you will be itching to do might have to take a back seat, or you might have to learn to do them in very strategic steps. So you may put a load of laundry on while the baby's asleep, and yes, that load of laundry may be finished and you haven't found time to put it in the dryer until in the evening.
yeah,
That might just be how you have to let it run.
yeah,
It is harder when you have a toddler,
yeah, yeah,
in
definitely.
addition to a baby and a C-section.
Hmm.
And especially if you don't have a lot of help,
Yeah, true.
it's a lot harder.
Or even if they want to be picked up and just getting down.
And you can't.
Yeah. So
You can hold them on your lap on the couch or something. They can climb up onto you, but you will struggle if you're trying to pick them up from standing.
yeah, okay, great. Can you, in layman's terms, explain the actual procedure of the C-section and where it gets cut and how things are moved around and, in
Uh,
a very short way?
yeah, I'll try to do it shortly because he's hungry.
Okay, good. We'll have to feed. Yes.
So I have to go
Yeah.
feed. But so in layman's terms, 2 centimeters roughly above your pubic bone is where we cut through the skin, cut through the fat layer, the layer of muscle called the sheath, the fibrous tissue that separates the, so it's a part of the muscular layer,
Mhm.
and separates the insides of your abdomen to the, from the outside, from the fat and the skin. And then we kind of stretch all of those so the sheath, the muscle, and we enter into the abdominal cavity. And then we cut into the uterus in the lower segment. So that's the lower portion of the uterus in a sideways cut. Take the baby out, take the placenta out, make sure that the uterine cavity is empty, repair the uterus, check everything, make sure that there's, all the bleeding stopped or that we don't have any major bleeding, and then close all those layers back up. So a lot of the healing that has to be done is not just on the uterus, but for those muscles that we've stretched, the skin, the fat, all of that has to heal.
Yeah, yeah. And all the drinking of water and all that hydration levels and all that sort of stuff. I mean, that's one thing.
I
But
think, that's important. More so, yes, healing, yes, but like if you're going to be breastfeeding, it's very important for breastfeeding.
Mhm.
And I guess it's just important that, you keep your body healthy.
Yeah,
So
yeah,
a balanced diet, good hydration, all of that will promote healing.
yeah. Great. Okay, well, you're doing great. 2 weeks in, we might check in with you in another 2 weeks and 6 weeks and have
See
the
how we go.
have the little process of, you know, Dr. Ruth Sterling way of, you know, how she's handling her cesarean section and post stuff like that. Yeah, so that's great.
Yeah.
All right, awesome. Well, thank you for that, and I look forward to seeing you soon, hopefully.
All right. Fingers
Yeah.
crossed.
Yeah, that's right. Okay, thank you so much.